Hi guys, this is Dr. Nicole Hemkes coming to you from Advocate MD in Middleton, Wisconsin. I've got my coat on today because it's a cold Wisconsin day. I think it's in the single digits outside and it's snowing. But today I wanted to talk to you about health insurance and health care and why health care and by default health insurance is so expensive, and how I think that Advocate MD and direct primary care can help with this, hopefully help you and your family. So healthcare was developed or came about as a means to pay for your medical care. As medical expenses started to become more expensive, 30, 40 years ago, in many cases, patients paid out of pocket. You went into the doctor, you paid your $100, $50, you had your medication, you paid out of pocket for all of these things. But slowly, of course, as everything, the cost of medical care has increased. But surprisingly, the cost of medical care compared to other things has increased at a exponentially higher rate than anything else. All of our other expenses, whether it's housing or food or electricity, all of these things have increased at a more gradual rate. But the rate of healthcare or medical care has increased at a much steeper rate. So along with that, our health insurance has increased at a much steeper rate. So what happened in 2010, the Affordable Care Act was passed, and the thought behind this was a good one, that we wanted to provide more people with health insurance. And it has done that. The rate of uninsured has gone from approximately 18% to maybe 10%, but maybe slightly higher in the past year. Along with that, though, what happened for people that had insurance was that their premiums started to increase. Their deductibles increased and their copays increased. So prior to 2010, the average individual had a deductible of less than $1,000. Now the average individual has a deductible of $2,500, and the average family has a deductible of $4,500. So these numbers have gone up significantly, and again, copays increased. So why is the cost of all of this healthcare going up? Or is the cost truly going up? Or is it just prices going up? So in actuality, the cost might not be going up, but prices definitely are going up. And the two thoughts, they've recently been talking in Congress. Senator Lamar Alexander talked about this on the Senate floor. They had experts come and testify from around the country. And the two factors that they have found that has increased significantly healthcare cost or prices in the United States, that sets us higher than any other country. Two things: healthcare administration, that we have much more complicated and complex processes to do things that should be simplified, and the fact that healthcare prices are not transparent. So let's talk about healthcare administration. Over the last 30 years, the number of healthcare administrators involved in our system, again, has increased at an exponential rate. The number that they quote is 3,500% increase in the last 30 years, while the rate of physicians has remained relatively stagnant. So, obviously, those additional cost of those salaries of those people has to go somewhere. Then the other side of that, pricing and transparency of pricing, is that there is no transparency of pricing in our healthcare system. Unlike if you walk into a restaurant and there's a menu up on the wall and you know what you're ordering and you know how much you're going to pay, and they're going to add the tax maybe, and then you're going to come out with X amount. Unfortunately, you can't walk into a hospital and say, I need a total knee replacement with anesthetic, and I'm going to be in the hospital for 3 days, and how much is that going to run me? Because they're not going to tell you the price of that. They won't even be able to, in most cases, even give you a ballpark, because if you have insurance, they'll say you have to run it through their insurance first. If you don't have insurance, in many cases, they won't even provide you a cash price. So what does that do? That allows them to charge whatever price they want to charge. There is a very smart doctor out of Michigan, Dr. Chad Savage, that does lectures on the The fallacy of pricing, he calls it. So we all think that things like MRIs are expensive. MRIs are thousands of dollars. Labs, you go into the hospital, you pay hundreds of dollars, thousands of dollars for your labs. Not true. You can get an outpatient MRI for $300, $350. You can get your lab work done for less than $10. I know that this sounds incredibly surprising. So here at Advocate MD, we do labs in the office. We charge cash pricing. I do not put any markup on the labs. I charge you exactly what I am paying to have that lab performed. So all of our labs, we advertise the pricing of all of these, and this is just a sample. This is not all the labs that we do. So you see, for example, a complete blood count, a CBC. Now the price that's listed here is the retail price. So this is almost sort of like the cash price. If you walked into the doctor's office and said, I don't have insurance, how much are you going to charge me for this? They might charge you about $40, but the actual cost of that test is $1.50. So you look at a TSH, thyroid stimulating hormone, again, retail price $60. The actual cost of that test is $5. You look again, urinalysis, $40. The cost of that test is $1.63. So let me give you my own personal example. So I had to get a blood work done, had one blood test done, went to one of the local hospital-owned labs here, an outpatient lab, and I had my one TSH, thyroid stimulating hormone, checked, and I got a bill in the mail for $233. So let's look again and see that thyroid stimulating hormone is $60 retail, and my cost is $5. So why would that test be $233? Because they charged me a facility fee or a hospital processing fee for the blood, and this is with having insurance. So the sad part, and the part that people don't realize, and when they realize it, it makes them mad, rightfully so, is that because you have insurance, in many cases, you are paying more. So again, let me just say that because it sounds crazy. You have insurance, and you are paying more than somebody, for example, that might have walked in and said, I don't have insurance, what is the cash price? So you pay more for your labs. You also pay, in many cases, more for your drugs, for your medications. So I can dispense medications out of the office. I buy them wholesale, and I dispense them for the price that I pay for them. I do not put any markup on the medications. So again, let me give you an example. So I go to the doctor, I'm sick. They diagnose me with an infection. They give me a prescription for azithromycin, a Z-Pak. I go drive over to the local drugstore, and I get there, and they say, okay, well, that prescription is $80, but your insurance is going to pay $60 of it, so you're only paying $20. And so I actually feel pretty good about that. I think $20, that's not too bad. And they give me a $60 discount off of that price. So that was a great deal. No, it wasn't a great deal, because that Z-Pak is $1.75. So again, the fallacy of pricing, the non-transparency that, they don't tell us what the price of anything cost. So again, with your medications, you are most likely, because you have insurance, they are marking up the medication price, not the cost, and then they are negotiating that down, and they're saying you're responsible for X amount, but in reality, that amount that you're responsible for is most likely higher than the cash price of if you were paying out of pocket for this. So unfortunately, sometimes even though we have insurance, we end up paying out of pocket for labs, for medications, for imaging. I also send patients and do cash pricing on imaging, x-rays, ultrasounds, MRIs. All of these things, if we do not go through our insurance, can be significantly cheaper. So I know that this is really surprising and in some cases unbelievable, but I welcome you to visit our website. I welcome you to call me, 608-268-6211. We are located at 3205 Glacier Ridge Road in Middleton, Wisconsin. The practice is called Advocate MD. I am the owner, and the medical director, and we see patients that we do not bill anything through insurance. We contract directly with the patient for an affordable monthly membership fee. The fee for adults averages approximately $80 a month. For children, averages approximately $30 per month. And then this also gives you access to all of these discounted prices on medications and the discounted prices on labs and x-rays and all of these things, again, because we are not going through insurance. There is no artificial markup and discounting down and making you feel like you've gotten some kind of a bargain. We don't believe in all of that, all those games. We believe in transparent pricing. We believe in telling the patient what the cost of something is, allowing them the choice to make that choice, giving them options in terms of you can go to this place and get an MRI and pay X amount. You can go down the, maybe 30 minutes away and pay $200 cheaper. We will show you all the choices. We'll show you all the options. Please consider us because we are a better alternative to your traditional health insurance that you are paying too much for. Thank you so much. I'm Dr. Nicole Hemkes, owner and medical director of Advocate MD. Thank you.